So what we got here is a 45-year-old guy who's presenting after a house fire. He appears to be confused, he's tachypneic, he's hypotensive. On physical exam, they're telling us he's got singed nasal hairs and soot around his mouth, telling that the patient is exposed to quite a bit of burns that's actually going on. Now, when you look at the patient's labs, we see that they're giving us a blood gas and they're telling us the patient has a metabolic acidosis. Your bicarb is low and your pH is at 7.2 and his lactate is significantly elevated. Now, reading through a clinical vignette like this, your mind is automatically thinking, hey, the patient is in a house fire, he's got signs of burns around his mouth as well as his nasal area. That tells us, well, we should be thinking more along the lines of carbon monoxide poisoning. And then you come to the last line of the question and they bust your bubble. And what do they say? They say the patient's carbon monoxide level is not really that elevated. And they also tell you the patient's pulse oximetry is reading normal. Now let's put some things into clinical perspective straight off the bat. Yes, we are going to think of carbon monoxide poisoning straight off when you read this clinical vignette. Now when you look at the pulse oximetry, normally your pulse ox would be normal in a patient with carbon monoxide poisoning. Why? Because carbon monoxide does bind to hemoglobin and form something we call as carboxyhemoglobin. But your regular pulse oximetry that you actually use, it cannot differentiate between your carboxyhemoglobin and your normal hemoglobin. And that's why your pulse oximetry is going to read completely normal. Your next important step when you suspect a patient with carbon monoxide poisoning is in fact to do something we call as a CO-oximeter. It is basically when you take the patient's blood and you put on the CO-oximeter and it's going to tell you if the patient's got carboxyhemoglobin levels. What else can the CO-oximeter tell us? It can tell us 4 different types of hemoglobin. It can tell you oxyhemoglobin, deoxyhemoglobin, carboxyhemoglobin as well as methemoglobin. So the CO-oximeter is what's going to tell us the answer in this clinical vignette to tell us what the carboxyhemoglobin level actually is. But they tell you that the patient's carboxyhemoglobin level is only slightly elevated. So why do you have a slightly elevated carboxyhemoglobin level but the patient is in metabolic acidosis and his lactate is almost 12? That is very, very high. Something does not add here, doesn't it? Now, this is where you got to start thinking a little deeper. If they're trying to point you towards a distraction which might be carboxyhemoglobin and a carbon monoxide poisoning, what you should think about coexisting most of the time is going to be the concurrent presence of cyanide toxicity. What is that? How are you going to get cyanide toxicity from burns? Let me tell you how. You know vinyl that's used in a lot of material that you use inside your house? Vinyl actually contains cyanide. So whenever the house burns, the vinyl is going to release cyanide. Now cyanide is going to cause cyanide toxicity. So whenever you have cyanide toxicity, again your patient's pulse oximetry is going to be fine. Why? Because your oxygen saturation is okay. But what does cyanide do?